Hello everyone, welcome to the eProtect pre-deployment training for acute respiratory infections, also known as ARIs. This was developed by the World Health Organization, and I'm going to be walking you through the message and the important topics that it talks about. So we'll start the objectives of this. By the end of the session, we hope that you'll be able to describe basic information about acute respiratory infections and how they're transmitted between people and even other animals, and to summarize the symptoms, the treatment, and prevention of ARIs of public health concern. So in this session, the first of 4 sessions, what we're going to be doing is introducing the acute respiratory infections, what they are and how they are transmitted, and give some examples of acute respiratory infections of potential concern. Not all ARIs are very concerning, but many of them are, and that's what we're going to be discussing today. And we're also going to be discussing some major global ARI events. And of course, during this time, I think this topic especially concerns all of us. So during this presentation, if you guys have any questions, feel free to type them in the chat. And after each slide, if there are questions that come up during that slide, then we'll take a minute after the slide to answer those questions and possibly get into further discussion if it's necessary. Moving on. So ARIs, or acute respiratory infections. What are they and how are they transmitted? So what are they? ARIs, acute respiratory infections. An acute respiratory infection is a disease of the respiratory tract, which is basically the part of your body that is related to breathing. ARIs are an infection of that area caused by an infectious agent, and there are various infectious agents. So some symptoms typically arise within hours to days, depending on the type of virus or pathogen. It could be viral, bacterial, a combination of others, or other disease-causing agents. ARIs can be mild, not having too much effect, to severe, putting you into the hospital or emergency room, to fatal, which of course is the worst outcome, depending on the interactions between the pathogen, the virus or the bacteria, and the host, which would be the human or the animal who gets infected, and the environment. Some infections can even be asymptomatic, basically not presenting any symptoms. Asymptomatic, you can get the disease, you can be infected, but you won't show it in any way. Typical symptoms include, and I'm sure almost everyone has seen these symptoms: fever, runny nose, sneezing, coughing, lethargy, or generally being tired, body aches, sore throats, shortness of breath, wheezing, and difficulty breathing in severe cases. So ARIs are classified into 2 classifications, 2 types: upper respiratory tract infection, so that's the infection of the nose and throat, the upper part of the part of your body related to breathing, and the lower respiratory tract infection. So that's an infection of lungs, such as pneumonia or bronchitis. Lower respiratory tract infections often require hospitalization and can be severe and life-threatening, and sometimes be fatal, unfortunately. So ARIs are very common in widespread disease. Everyone can get ARIs, simply by the fact that everybody breathes and everybody uses the respiratory tract. Lower respiratory tract infections, a severe form of acute respiratory infections, are the leading cause of illness and death worldwide. And this is not only a single type of ARI. All ARIs combined are the leading cause of illness and death worldwide. In lower income countries, lower respiratory tract infection is the #1 killer of children under 5 years of age, unfortunately. LRTI can be serious and life-threatening, particularly in the very old, the very young, pregnant women, and people living with existing chronic medical conditions. So maybe something to point out here, the difference between what we call acute and chronic would simply be, and this is generally accepted, as the amount of time that an infection remains present for any illness or condition. So generally, within the first 2 weeks of an infection presenting, it's considered acute. And if it's not cured or mitigated after 2 weeks, then simply it's described as chronic after that point, or ongoing. After the 2-week mark, most illnesses become much more dangerous and much more difficult to treat. So, who is affected by ARIs? To talk about who is affected, we need to know a few more details, such as the elements of the infection. So the pathogen, which is the infectious agent, the virus or the bacteria, whatever the agent is causing the infection. So we need to know the mode of transmission, transmissibility, so virulence, and for the host, which would be people in most cases that we're discussing, we need to know the ages, underlying diseases, like I mentioned, existing chronic diseases, nutritional status, so how are the people's diets, what are they eating? Are they eating healthily enough or not even eating enough? Occupations, immune status of the body, smoking status, concurrent or past infections with other pathogens, and these are only a few examples. There are many more things we can know about the host that can help us understand ARIs. We also need to know about the environment. We need to know about the physical environment, the air quality. Is there pollution? Is the air clean? Crowding? How close in proximity are people normally, especially when they go outside in groups or public places? The temperature and humidity, the basic climate of the environment. Also hygiene. Is garbage present predominantly, for example, on the streets, or are public and private areas normally kept very clean? These are very important to know, as well as the contextual environment. So healthcare access and quality, we might consider this amenities or services, the quality of healthcare that people can access, and infection control and prevention measures, such as many of you might have been seeing in your countries these past few months, such as isolation, barrier nursing, as well as medical countermeasures like vaccines and therapeutics, antibiotics, these all fall under countermeasures. So what is the interaction of host of these three aspects? So we're talking about the host-pathogen-environment combination, and how does this create the illness? So the host susceptibility, that would be the people who have chance to become infected. The disease transmission and disease severity are all variables for respiratory infections because of the interactions of these three factors, the host, pathogen, and environment. So the host factors, such as the immune system, or the presence of underlying conditions, or other factors that we've discussed, can affect how susceptible or how likely an individual is to get sick with a pathogen or be infected by an ARI, and how severe the disease will be. So variations in the pathogen can also affect how easily it is transmitted and how severe the disease will be as well. And commonly we refer to this as mutation in the pathogen. So moving along with the interactions, the other environmental factors, both physical and societal, that we discussed, access to hospitals, etc., can also affect the transmission of the pathogen as well as the susceptibility of the host to infection. Um, so while all people may be at risk to some varying degrees, the level of risk is dependent on multiple factors, including these ones that we discussed. So risk assessment needs to be done in the context of considering the pathogen as well as the other factors that may play a role. So why are certain ARIs of concern to the public? And you might also say, why are certain ARIs not of concern? So ARIs are easily transmitted from person to person, normally just through the air, just by breathing with people around you. The diseases can become very severe. High illness, death, and risk of sequelae, or consequent illnesses as a result of the ARI. Complications and long-lasting effects, for example, pneumonia and bronchitis can cause long-lasting effects, especially if they become chronic. They can completely affect your respiratory tract. So other concerns are lack of underlying immunity in the population. This is an especial concern for novel illnesses, novel diseases. You may have heard about herd immunity. So the idea is that throughout time, we become immune to diseases that we're exposed to, just through the virtue of our bodies being able to eventually recognize diseases and build up specific defense that we call immunity against those illnesses or pathogens. But for novel viruses, novel illnesses, there is no underlying immunity, as well as having no available vaccine or treatment or resistant to existing treatment. So resistance to an existing treatment can also happen in existing pathogens, like we mentioned before, through mutation. Viruses and bacteria can also develop resistance to, for example, penicillin. So penicillin is a great example of, at the time when it was developed, it was an extremely effective antibiotic. But nowadays, it's not strong enough to combat most existing pathogens. So scientists have had to develop stronger, more effective antibiotics than penicillin. Moving on, so other concerns are unknown or new pathogens, like we've been discussing, and new pathogens are definitely the topic of concern today, as well as the size of the outbreak. So some examples of acute respiratory infections of particular public health concerns are influenza viruses, or just called the flu, causing an infection for which the population has little to no underlying immunity. Normally, this is due to regular mutation in the disease, so non-seasonal flu especially. Severe acute respiratory syndrome, also known as SARS, as well as Middle Eastern respiratory syndrome, also known as MERS, and novel or, as we've discussed, unknown pathogens with potential for a high public health impact, as well as other pathogens, pneumonic plague, Legionella. These are definitely a concern, but not as common. So what are non-seasonal flu viruses? These can include viruses that are circulating in animal populations, actually, called zoonotic influenza viruses, such as, I think everyone's heard of the avian flu by this point, H5N1, and the variants, the swine flu as well, H1N1, and newly emerged flu viruses from genetic mutation and exchange. These can create potential pandemic viruses, which is what we're seeing today. So human cases are considered rare, and they are most often acquired through direct or indirect contact with infected animals or contaminated environment. You may have read about the possible origins of COVID-19, and most research has indicated that it came from some type of animal and transmitted through contact from that animal through human and the current pandemic. So there has not been any sustained transmission of these viruses among humans. Human cases with known zoonotic influenza viruses have been reported from approximately 20 countries around the world. So we're talking about these, the avian flu, the bird flu, the swine flu. So human infections can be asymptomatic or not presenting symptoms, as we discussed, or can cause a range of symptoms from conjunctivitis, pink eye, normally viral pink eye, bacterial, to fever and cough, to shortness of breath. Pneumonia, an infection in the lungs, may occur and may require hospitalization and intensive medical treatment. Some deaths have been reported. So gastrointestinal symptoms, symptoms related to your digestion, such as vomiting, diarrhea, and abdominal pain. These have also been reported among pneumonia patients. So if you've just joined us recently, feel free to type any of your questions or comments in the chat, and at regular intervals during this webinar, we will address any questions or comments you have. So how can infection with non-seasonal flu be treated? There's evidence that some antiviral drugs can be useful in treating humans infected with these known non-seasonal flu viruses. Antiviral drugs should be administered when the infection is suspected without waiting for diagnosis. The main reason for this is the earlier you catch it, the less time any infection or virus has to spread. So without waiting for diagnosis, ideally, but not limited to, within 48 hours of symptom onset to maximize their benefit. Of course, you may not even know you're infected if you're not presenting any symptoms, but within 48 hours of showing symptoms, if you administer any of these antiviral drugs, that will maximize their benefit. So other treatments are supportive and based on the patient's clinical condition. So mechanical ventilation, in the case of respiratory system failure. Yes, these are mostly treating these symptoms and supporting the patient in attempting to recover. So we want to detect and control the virus infection in animal population. This is called the One Health approach. By avoiding direct and indirect contact with affected animals in areas where the bird or swine flu viruses are known to be circulated. Avoid the consumption of raw or undercooked animal products. We'll go into slightly more detail on this in a bit. And always cook food thoroughly. So special precautions should be taken in healthcare settings to prevent the spread of the virus among patients and between patients and healthcare providers. You can imagine in a hospital, people go to the hospital because they're sick. So basically, hospitals are full of people with illnesses and healthcare professionals. So yes, definitely special precautions should be taken in healthcare settings. We need to practice good hygiene, especially regular hand washing before and after touching animals at farms or markets or other places where animals may be present. So we have more information on the types of non-seasonal flu viruses. We have information on Actually, I can pull these up. So here we have a document by the World Health Organization discussing flu virus infections in humans, and it discusses the seasonal flu, pandemic flu, zoonotic variants, and next you see the links. Here we have it. So that was types of influenza in humans, and we have the flu at the human-animal interface, such as avian and other zoonotic influenza. These pages are all available on the WHO website. Next, discussing H5N1, so the bird flu. I think frequently asked questions about the bird flu. What is H5N1? It's a type of flu that causes highly infectious severe respiratory disease in birds called avian influenza or bird flu. So how does it spread? Why is there so much concern about H5N1? Why might the H5N1 flu virus change? Great answers to all of these questions. And the same for other types of flu. A different strain of the bird flu, H7N9. Here we also have a page talking about the swine flu in humans. Let's open this up. It seems to be redirected. We'll share this document with you at the end of the webinar, so you can go directly to these links yourselves without having to worry about copying them down or trying to write them out now. So let's continue. MERS, or Middle Eastern Respiratory Syndrome. MERS is an acute respiratory infection caused by a coronavirus variant. So it was first reported in a severe pneumonia patient in the Kingdom of Saudi Arabia in 2012. And as of January of this year, it's caused over 2,500 human infections and over 800 deaths. Most human cases have been reported in the countries of the Arabian Peninsula, and cases and outbreaks have been reported by countries outside the Middle East, but these are usually related to infections initially acquired in the Middle East, and the host simply traveling back home after they are infected. So human-to-human transmission in healthcare settings, it accounts for the majority of the MERS cases worldwide. MERS has not yet caused widespread outbreaks outside of healthcare settings, meaning it hasn't reached. We have a question. Okay, we'll hopefully get to COVID-19 soon, and Shadia, yes, we will get certificates. We'll get certificates of attendance at the end of this webinar. Yes, guys, feel free to put your questions in the chat, and we can address them at regular intervals. Moving on, so there was a large outbreak of MERS in hospitals in the Republic of Korea in May and June 2015, following a human case who traveled to the Middle East and came back to Korea. MERS is widely circulating among dromedary camels. Remember we discussed the vector or the relationship between humans and animals, the interaction. So dromedary camels are thought to be transmitted to human via direct or indirect contact with camels or camel-related products, such as raw camel milk. So a mode of transmission, infected people can transmit the virus to other people in close contact, like most flus. This has most often occurred in healthcare settings among patients and between patients and their caregivers. Like we discussed, the healthcare environment, the healthcare setting is not ideal for dealing with these infections. Incubation period, 5 days on average, so with a range between 2 to 14 days. So that is the time period before most hosts or most people who are infected begin to show symptoms. The susceptible groups are similar as before. Healthcare workers, people caring for cases, are at risk of infection because of their close contact with patients, close and prolonged contact. So severe illness seems to occur more frequently in older people, people with compromised immune systems, and people with underlying medical conditions, as we discussed before, existing chronic diseases, heart disease, kidney disease, other lung diseases, diabetes, and cancer. And the symptoms in humans, human infections can be asymptomatic, not showing symptoms, or they can cause a range of symptoms from fever and coughing to shortness of breath. Pneumonia can occur and may require the host to be hospitalized and put in intensive care. Severe illness has resulted in death in about 1/3 of the cases. We mentioned 2,500 cases and 800 fatalities. In some cases, infected patients have also reported gastrointestinal illness or diarrhea, illness related to the digestive tract that we discussed before. There's currently no specific treatment for MERS infection in humans, so treatment is supportive and based on the patient's clinical condition, like we discussed before, mechanical ventilation in case of respiratory system failure, and supportive treatment to assist the patient in recovery. So how can infection with MERS be prevented? So we want to avoid unprotected contact with dromedary camels, especially. People with underlying medical conditions, as we discussed previously, should definitely avoid contact with camels if possible. And you need to avoid the consumption of raw or undercooked animal products, including milk, meat, and urine. Yes, this has to be mentioned in this world of ours with 7 billion people spread across the globe. Many practices exist, and we need to identify the ones that can cause infections. So we also want to practice good hygiene, especially regular hand washing before and after touching animals at farms, markets, or other places where camels may be present. We want to take special precautions in healthcare settings, as already discussed, to prevent the spread of the virus among patients and between patients and healthcare providers. And this is one of the reasons for quarantine possible coronavirus infections. So, refer to websites for more information about MERS. Like I said, we'll share this file with you so you can go directly to the links afterwards. So some major global ARI events. We have flu pandemics. 1918 is definitely the big one. We have the Spanish flu, which many people are actually talking about and comparing to COVID-19 at the moment, especially the pandemic aspect of it. Other flu pandemics in 1957, 68, and 2009. The bird flu event in 1997 in humans. In 2002, the SARS event in China, another bird flu event in 2003 in Eurasia and Africa, causing infections in 15 countries. MERS event in Saudi Arabia in 2012, more bird flu, a different strain this time in 2013 in China. And at the end of 2019, COVID-19 emerging in China. So these are information about acute respiratory infections. We're going to be moving on to a short video about ways to protect yourself from infection. I need some water. It's not discussed. Hey everyone, welcome back. Sorry about that minute of technical difficulty. We're continuing now with basic hygiene measures that we can all take, that everyone can take. And I've also, as a personal note, my children have also learned to take all of the basic hygiene measures as well. So the objectives of this module are hopefully by the end you will be able to list basic hygiene measures necessary to protect yourself and others around you from respiratory and other infectious diseases. Apply key principles of basic hygiene while working in the context of respiratory disease outbreaks. And in this module, we will be introducing the basic hygiene measures such as hand hygiene, respiratory hygiene, and maintaining distance, also known as social distancing. Some considerations in performing hygiene measures and recommended items to bring with you, what you might want to carry around, keep at home, and some key messages. So, measures to perform in any setting and be augmented by other measures in particular situations, settings. So we can think of this as two levels, which are the measures that we want to be performing all the time, everywhere, and in addition to that, in certain situations, additional measures, such as maintaining distance of at least 1 meter. Depending on where you are, some countries have actually instituted regulations about social distancing. I think that are, if they're not 1 meter, some countries have regulated more than 1 meter of social distancing, for example. So from people with respiratory symptoms. Basic hygiene measures are hand hygiene. So keeping your hands hygienic, respiratory hygiene, practicing good hygiene or coughing, sneezing, etc., and avoiding close contact with sick people. So when should we perform hand hygiene? This is a great chart because you might not think, or you might think that hand hygiene is necessary to be performed all the time during any activity, before or after or whatever. But it's actually not necessary. For example, preparing food, you should always wash your hands before, during, and after preparing food. You think about food when you're preparing it, it's uncooked, and when you're basically, your hands are in the food during the whole process, before, during, and after. And eating, you should wash your hands before eating. There's not really a point to wash your hands during eating, and definitely after eating, because it's a manual activity. You're using your hands in order to make sure they're hygienic. Blowing your nose and coughing and sneezing, there's no real point to performing hand hygiene before either of these activities, but definitely after. So caring for someone. This could be doing any simple services for someone, any caretaking activities. You should perform hand hygiene before and after caring for someone. And then touching animals, animal feed, or animal waste. Again, there's no real point to, for yourself personally, to perform hand hygiene before touching an animal. But afterwards, there is definitely a point, because after you touch them, your hands have the potential to become contaminated after the touching, but not before. So this is why we perform hand hygiene after these activities. Touching garbage, of course, the same idea. We want to perform hand hygiene afterwards, and using the toilet. You can see there is a pattern here in the performing hand hygiene after activities. You can see you need to perform hand hygiene after every single activity. but we don't need to perform hand hygiene before every activity or during. So what do you use to perform hand hygiene? When hands are visibly soiled, use soap and water. That means if you can see that your hands are dirty, or if there's other material on your hands that you need to wash off, then use soap and water. When hands are not visibly soiled, you can use alcohol-based hand rub or soap and water. Of course, you can always use soap and water. And current research has shown that warm soap and water is actually more effective at killing or performing hand hygiene than alcohol-based hand rub. But if your hands are not visibly soiled, rubbing alcohol-based hand rub is completely acceptable. So, how to hand rub or how to wash your hands? There is actually a, let's say, official technique. So we want to wash our hands or rub our hands for 20 to 30 seconds if they're not visibly soiled. And on the left here we see if duration of the entire procedure 20 to 30 seconds, and that's rub hands for hand hygiene, wash hands when visibly soiled, and wash hands when visibly soiled, otherwise use hand rub. So the hand rub is with the alcohol-based hand rub, and you want to apply a palmful of the product in a cupped hand, covering all surfaces, and rub hand palm to palm, this, palm to palm. Then we want to rub right palm over left dorsum. So that's putting our right hand over our left hand as such. And this will clean between the fingers. And then palm to palm with fingers interlaced. It's a bit unusual. You might not consider how difficult it is to actually get your hands completely clean. But this is a wonderful technique. So the next step, what we want to do, palm to palm with fingers interlaced, and then the back of, and this again cleans between the fingers, which you might not always access. And then the next step, backs of fingers to opposing palms, and what that looks like, it looks like this. It looks like you're grabbing your fingers, your own fingers, you're grabbing your own hands. And the point of this step is to clean the tips of your fingers, the ends of your fingers. And then we want to clean inside our knuckle, the thumb. So rotating and rubbing the left thumb and the right thumb and vice versa. And then rotational rubbing, backwards and forwards with clasped fingers of right hand and left palm. So that would look like this. Okay? And vice versa. Okay? And then once dry, your hands are safe. And this is the how to perform the hand rub. Now the hand wash is very similar. It's almost identical process, only takes a bit more time. So the first step is to wet our hands. We want to have our hands wet before we apply the soap. This is actually important and makes a big difference. We get a much stronger soap lather if your hands are wet before you apply the soap. So the same idea, palm to palm, between the fingers, and then between the fingers again, clasping, right? Grasping the fingers on either side, and then cleaning the knuckles, the palm, and at this point, we want to rinse with water. Of course, rinse all the soap lather off, and then dry hands thoroughly with a single-use towel, especially if you're in public. And then use use the towel to turn off the faucet. This is an important point because most people don't consider what they're touching after they wash their hands. You might think you've washed your hands and you're safe, and you can go ahead and turn off the faucet and open the bathroom door, etc. But that's just going to undo all of the washing that you just did. So 20 to 30 seconds with alcohol-based hand rub, and 40 to 60 seconds with soap and water. Respiratory hygiene. So you want to cover your mouth and nose with a disposable tissue when coughing or sneezing. This is the ideal response. If you're coughing or sneezing with a disposable tissue, I think all of us have disposable tissues at our disposal at any given location. You want to discard the tissue immediately into a no-touch waste bin if available, or clean them appropriately after use. Wash handkerchiefs using regular soap or detergent and water. And what we mean by this handkerchiefs is multiple use fabric, not single-use tissue. If you don't have a tissue, you may sneeze into your elbow, and you may see many people, if they have tissues or not, maybe the common instinct is to simply sneeze into your hands or in a different area. Now, this will just simply cover your hands with whatever particles or agents were in your sneeze. And then you definitely need to immediately wash your hands if that is what you do. But the better alternative, if you don't have a tissue, is to sneeze into your elbow. I taught my children this a long time ago, and at home we call it the vampire sneeze, or the vampire cough, depending on whether you're sneezing or coughing. And the idea is you sneeze into your elbow, not the end of your elbow, the corner of your elbow, like this. You may see this commonly now because it is a best practice if you don't have a tissue. And at home we call it the vampire sneeze because the vampires, they have a cape and they like to cover their faces. So that is a little tip if you need to teach children these hygiene techniques. And as always, perform hand hygiene afterwards. So maintaining distance. I think all of us may have had experience by now about maintaining distance, social distancing, maybe even quarantine in some cases, or curfews. So we want to reduce the time spent in crowded places, as the likelihood of coming in contact with people who are ill is higher in crowds and simply increases over time. So keep this to a minimum, time spent in crowded places. We also want to keep a distance of at least 1 meter. So that's greater than an arm's length, practically, if you're unsure of a meter. So from people who are coughing or sneezing. So basically, your personal space, you want to keep everyone at arm's length and avoid getting nearer than that to anybody, especially in crowded and public places. You want to avoid touching, shaking hands, or kissing sick people, simply because these are all vectors for transmission, physical contact, sharing airspace, breathing around other people. So some considerations in performing these hygiene measures. The main aim is to help protect you from getting infected. Of course, there's benefits for society and community with fewer infections. If you don't get infected, there's no chance you can infect other people, but the primary goal is to protect you from getting infected. The measures should be performed with due consideration of the context you're in. So if water is scarce or unclean, you definitely might want to prefer alcohol-based hand rub, at least when your hands are not visibly soiled. Handshake or gratings with contact is the norm. Of course, this is different all around the world. Greetings, handshakes have become kind of ubiquitous, but we want to avoid physical contact. At the same time, we need to consider being as culturally sensitive as possible, depending on where you are and who you're interacting with. Disposing used materials, tissues, etc. You can bring your own resealable bag and dispose properly later if no proper garbage disposal equipment or trash can. Ideally, no-touch garbage bins where you don't have to touch anything to be able to throw the garbage away. Sometimes foot-operated with a lever, even automatic or electronic with motion sensors, such as these. And yeah, you can carry around your own resealable bag to dispose of your trash, such as tissues. So recommended items to carry with you. These are definitely good to carry with you in almost all circumstances. Alcohol-based hand rubs. Quickly rub your hands down 20 to 30 seconds as we saw, and your hands will be perfectly clean. And disposable face tissues for sneezing or coughing. We know these boxes of tissues that we all might have on our desk at this moment. You can carry around the small disposable bags of tissues, a thermometer, of course, because infections very commonly cause fever, and thermometers are a great way of catching infections in the early stages. If you notice a spike in someone's temperature or unusually high temperature for yourself or someone else. Disposable medical masks in case you develop respiratory symptoms. So there's not controversy, there's a lot of questions around this. So who does not recommend healthy people wear masks routinely? Now, it doesn't say healthy people should not wear masks. The main goal is to protect yourself from getting infected. What that means is we also want people around us to follow, hopefully, these same practices. And if someone is infected, if they wear a mask, the chance of infection is drastically reduced for anybody around them. And this reduction in the chance of infection is much higher than if a healthy person wears a mask. So masks, in this case, will block the infectious agents being breathed out by someone who's infected. They will also block infectious agents from entering your body through the respiratory tract. But still, who does not recommend, WHO does not recommend healthy people wear masks routinely. At the same time, when I do go to public or crowded places, I tend to wear masks because it does have an impact. It is much safer. You can, as we mentioned before, carry resealable plastic bags to dispose of your waste and tissues and other things. So the key messages here we want to convey to perform basic hygiene measures at times and augment with other measures in particular situations and settings. There are many jokes around now about people burning 500 calories a day simply by washing their hands, but it really does have an effect. So to maintain your safety and to protect yourself, we really want to follow these practices. Basic hygiene measures include hand hygiene, like we discussed, respiratory hygiene, and maintaining distance. And the aim here is to protect you from infection. And this is why we follow these hygiene practices to protect ourselves. And you can follow them to protect yourself. So measures should also be performed with consideration of the context. We mentioned the maintaining some cultural sensitivity as well as performing these hygiene measures. We're going to take a quick break, let's say 2 minutes. We will be back in 2 minutes. Okay. Well, welcome back. This is the last module we'll be going through, and this is when and how to wear a mask, a medical mask. We've already mentioned that WHO does not recommend that healthy people wear masks, even though you can. It definitely has a positive impact in most cases, and basically it's personal preference at this point. So we have here, we hope you will be able to summarize when you should use a medical mask, describe the steps to put on a medical mask, and list the steps to take off a medical mask. So let's get into it. First we'll start with when to put on a medical mask and how to put on a medical mask, and then how to take it off. There are proper procedures for all of these. So when to put on a medical mask. So situation A, during a mission, if you develop respiratory symptoms. So respiratory symptoms, by respiratory symptoms we mean coughing, shortness of breath, sneezing, wheezing, these symptoms that we mentioned in the first module. And the reason for this is if you start developing these symptoms, you want to protect the environment, the other people around you, by containing the whatever agent is causing these respiratory symptoms. Situation B, if you're in close proximity, so less than 1 meter with someone with respiratory symptoms. And this is definitely all about protecting yourself at this point. So if you're in close proximity with someone with respiratory symptoms, that means that proximity is enough that their breathing will interact with your respiratory tract. And in this case, you definitely want to wear a mask to protect yourself and filter the air that you're inhaling. Situation C. If you're on a mission to a country with an acute respiratory infection outbreak, and you are expected to visit healthcare facilities with patients with respiratory symptoms. Remember, we also mentioned the healthcare settings as needing special attention or special care when dealing with infections, acute respiratory infections. And many countries are regulating the use of medical masks in healthcare facilities, whether you're healthy or not. They now more often than ever are requiring everybody to wear a medical face mask. So please, a note here, staff whose missions, terms of reference with it. So this note is not for everybody. It's specifically for WHO staff who are on specific missions to different countries or facilities and referencing their standard operating protocols. So how to put on a medical mask? 6 steps. We might have thought this was simple, but the proper procedure contains 6 steps. First, before touching the mask, you want to wash your hands with an alcohol-based hand rub or soap and water if your hands are visibly soiled, as we most recently discussed. So we want, after we wash or rub our hands, we're going to take a face mask and inspect it for tears or holes. I had an example here. Here we go. Here we go. Face mask. You want to inspect it for tears or holes. Obviously, if your face mask is torn or has holes in it, it's not going to be effective in filtering the air that you're breathing. So completely acceptable condition. We want to orient which side is the top side, where the metal strip is. And you might notice, maybe on the camera, this is hard to tell. But here on this side, there is a metal wire, you can say. And this is the top side. And you'll now see why we consider that the top. So you want to ensure the proper side of the mask faces outwards, the colored side. Unfortunately, mine is white. And the next way that we can tell this is by the orientation, and of course this varies from mask to mask, but the orientation of the elastic attachment. It's normally attached to the front of the mask. So we can orient this side to the front. The main reason for this is, if you see how the elastic is attached, when this is pulled back, it will create a tighter seal of the cloth on your face. If, let's say for example, we orient it this way and attach the mask as so, then because of the attachment of the elastic, it will not create as strong a seal on your face when worn. So we have it oriented properly. Let's see the next step. Step 5. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. And this is exactly why we orient the wire or the metal strip at the top. So here we go. Okay, it's centered. We pinch this. Okay, it's important to create a good seal. And we pull the mask bottom, and this is why it's corrugated, so that we can extend it, especially in this direction. Pull down the mask bottom so it covers your mouth and chin. You can see, of course, we can straighten it. Can you still hear me? So, this is a properly attached and oriented face mask. And this will protect you and others around you from exchanging infectious agents through breathing. Now, how to take off a face mask. After use, take off the mask, remove the elastic loops from behind the ears while keeping the mask away from your face and clothes to avoid touching potentially contaminated surfaces of the mask. So what do we consider the contaminated surfaces of the mask? Contaminated surfaces are all the surfaces that come in contact with the air that you're exhaling and the air that you're inhaling. That basically means pretty much the whole cloth part of the mask. So remove the elastic loops. It's another common practice to do one side and then the other. You can see I did not come in contact at all with either side of the mask itself. Now we simply just throw this away. And the next step is, you guessed it, perform hand hygiene after touching or discarding the mask. Now I only wore it for maybe 1 minute. You want to use alcohol-based hand rub, as we discussed before, 20 to 30 seconds. Or if visibly soiled, wash your hands with soap and water. Personally, I always wash my hands with soap and water. If I have a chance, I prefer that. Now I hope you remember when you should use a medical mask, and what distance is considered close proximity from a person with respiratory symptoms. Is it half a meter? Is it 1 meter? Is it 2 meters? Is it 5 meters? And how is a medical mask put on, taken away, and disposed of? I hope you can now remember all of these things. Okay. We've reached the end of Module 4, which means we've reached the end of this webinar. Now, please feel free to raise any comments or questions you have at this time. And I can go ahead and unmute everyone. Now, you can unmute yourselves if you'd like to discuss. Thank you for joining. Okay, thanks everybody for joining. I think if we don't have any additional questions or comments, then we're going to end here, and we'll be in contact with each of you participants to give you your certificate of attendance, and as well as forwarding you the material that we've covered today. We will email it to the email that you provided during the registration. So everyone, thanks again. Have a great day, and stay safe and practice good hygiene.